Hello guys, hope you are doing great. Today we're gonna continue talking of our metabolism because it's important for us to know how it works. If you're new to the channel, please remember to subscribe to activate the notification. You not to miss any video that we're gonna publicate. Today the central point is the blood pressure. What is blood pressure and what is it so important? The formula of the blood pressure is the cardiac output time the systemic vascular resistance. The cardiac output is the amount of blood that the heart is pumping per minute throughout the body. And this is depend on our heart rate and the state of our arteries, because sometimes in our artery we have the presence of some cholesterol plaque which can damage the blood vessel. The systemic vascular resistance is just the amount of resistance that our blood vessels are creating when the heart is pumping the blood throughout our body. Blood pressure measurement is in millimeter of mercury, and it's composed by two numbers. The first one is the systolic. The systolic is just the pressure when our heart beats in our arteries. The second component is the diastolic. Diastolic is the pressure that we can register in our arteries between two heartbeats. About the standard of the blood pressure, the normal blood pressure, we have to be like systolic. Like we have 120 millimeter of mercury, and the diastolic is not over 80 millimeter of mercury. The situation in which our blood pressure is abnormal is usually called aneurysm. So aneurysm is localized and abnormal dilatation of our blood vessel due to the weakness in the wall of the vessel, and most commonly affect arteries. We have an important type of aneurysm, the cerebral aneurysm, which leads to stroke. So high blood pressure can damage the blood vessel, which can lead to the high production of the cholesterol plaque in the wall. This leads to things like heart attack or stroke when you are located in the brain. High blood pressure can lead to the microvasculature of our kidney. This is called the kidney disease. So now we're going to talk about how to lower our blood pressure. You can agree with me that regular exercise is a good way to lower our blood pressure. It's really confusing, because when you are exercising, your temperature is going up, the heart rate is going up, meaning that you are in hypertension. But it's not just that you're going to do one workout session and then you will say it's done. No, you have to think about a long-term process. So if you have a regular activity fitness session, you will notice that by the time your blood pressure will be lower. Some studies demonstrate that resistance training combined with light cardio session helps you in a regular time, because you have to put in some consistency, leads to decrease your systolic about 4 to 6 millimeter of mercury, and your diastolic is decreasing about by 3 millimeter of mercury. So think about the long term. The second way how to lower our blood pressure is to monitorize your diet, and the specific way is to lower the salt. So in your diet you have to decrease the way that you are consuming salt. Another way how you can use to lower your blood pressure is to focus on our breathing. This is really important, guys. It's not about meditation. If you're doing meditation, it's brilliant. But if you are not able to do meditation, it's just the fact that you have to, for some period of the day, for some period of time, about 5 and 10 minutes, 2 times per day, to have focus on your breathing. Most often we inhale 2 seconds and we exhale 1 second. If you have focus on your breathing and you control the time of breathing and breathe out, take an example and you have to try it. You can breathe in 4 seconds and breathe out 5 seconds. You do this exercise just 5 minutes, 10 minutes, 2 times per day for 6 months. This activity just asks you 5 minutes or 10 minutes per day, 2 times per day. Try it for an extended period like 6 months and you will notice the effect. This is scientifically proved. When you want to acquire a new activity, a new skill, you have to put in time, discipline, dedication, and consistency. This leads to a very important concept, the neuroplasticity. Practice skill and tissue. In that while you are practicing every day, this leads to skill, and this skill will produce new neurons in the physiologically plan. So it's a physical activity that becomes a physiologic activity and stay for long. So these are the way out you can try to lower your blood pressure. So guys, keep it in mind, control your blood pressure, have a regular activity fitness session the week, monitorize your quantity of salt that you are eating in our diet, and try this breathing. Have a good day. Remember to subscribe to our channel to not miss any video that we're gonna publicate.